Two, one. I just got back from my the clinic. I did the annual health checkup. I just want to remind everybody, especially for those entrepreneurs and business owners. I know you have been so obsessed running your business, uh, working, and then at the same time you have a full-time job to your family. You have to make sure that you're finding time at least once a year to do your annual health checkup, especially if you're 30 years old and above. Annual health checkup means your blood chemistry. You need to make sure your sugar is fine, your blood pressure, making sure that your cholesterol are always on check. Remember, I'm a nurse by profession, so prevention is always better than cure. I really recommend. Your health is your number one asset at this point. Never ever ignore that. Find time that you need to do this, especially if you have health insurance. Also, at the same time, do not forget your dental benefit. That is also part of checkup. Make sure you do your dental cleaning, dental x-ray at least twice a year. Check your insurance. They do provide that for free. You have to make the most out of it. Now, speaking of health insurance, here in America, since we're doing taxes through every, one thing that you need to remember if you're from here, that you can avail a free healthcare. So this is through the healthcare.gov. This is one of the programs of the previous administration, Obama. But the question is, how would you qualify for this free healthcare? The number one is you need to have a minimum income. Okay, you need to have a minimum income. It is not just easily free because you don't work. It's not will be given. It will not be given to you right there and then. Household income, for you to know where to find the minimum income requirement. This is going to be based on how many members of the family you have, whether married, filing jointly, head of household, single, how many dependents you have. Those are some of the eligibility requirement for them to determine. Again, you go to the healthcare.gov. That is where the marketplace for health insurance. Then you can just Google the minimum income requirement for the family needed for you to qualify. Okay, you should make minimum income but not too much income. And then from there, you could actually get from 60,000, $40,000. So the more that your income, the higher your income, the minimum will be the healthcare benefit. Okay, so that's how it works. The more income you make, the less benefit you get. Okay, and then from there, the next is go create your online account, healthcare.gov. You just go to their website. It's like creating a Facebook account, and then there's a preliminary survey from your pre-existing condition, and then the members of the family that were here. And then another requirement for you not to forget, you also need to have a social security number for you and then for the dependents and for your wife, because if you don't have it, might it's difficult. But I think this is just I think that there are some private company that can still give you the healthcare coverage, but it's not free. You have to pay extra, because our client right now, they just they just get here in the US. They've been here for 6 months, and this is the one that they've been shopping around. Another thing, do not forget open enrollment. For if this is too complex with you guys can message me. I have an agent, a broker who could walk you through as healthcare specialist for this type of benefits here in the US. And open enrollment begins this coming October. So do not forget to book your appointment. And I think that's all for me today. Make sure you spend time for yourself to do your annual checkup, your health, your teeth, your vision, because this is your number one asset here. Whatever you're doing, find time. And because money can recover. You can recover money, but health, always remember, we only have one life to live, so make it count. Okay, guys, thank you for watching. If you like this, please click share and subscribe to my YouTube channel today. Stay safe. Bye bye.